Welcome to part 2 of our interview with Fulton County Health Officer Dr. Craig Bugno. Is there enough vaccine for Fulton County? Swine flu vaccine?
Well, right now there isn't any swine flu vaccine or H1N1 vaccine that's not being used for clinical trials. And right now it's in clinical trials in designated sites within the United States. Depending on how much will be available, we will have, to the state, we will have an allocation that is proportional to our population. There's been some difficulty with getting this virus to cooperate and make a vaccine, and that goes beyond my, I'm not a virologist, so that goes beyond my level of expertise to explain what those difficulties are, and the number of doses that will be available initially are not enough to immunize the entire population. And so we will immunize in phases, targeting the high-risk groups first.
And who are those high-risk groups?
Okay. And probably it would be better to say high-priority groups, because, again, we're not so much worried about the intensity of the disease as everybody getting it at one time. So we're most concerned about pregnant women, children under 6, and adults 64 and under who have chronic debilitating diseases. And so we're concerned with them from a standpoint of worried about them getting sick with the disease. Now, we're also concerned with first responders and healthcare workers. And we're concerned with them because we don't want them to all get sick at once, because then there'll be nobody to fight fires, answer police calls, take care of sick people, and so on. And as well, we're concerned with people, children who are in school, generally the age groups 6 to 24, as well as the staff of schools. And we're concerned there because the people that tend to have the greatest difficulty with the disease are young, healthy people. And also, the transmission is much easier when everybody is kind of stacked together like they would be in a school building. So when we get the vaccine, we will attempt to immunize the priority groups. When we've been able to immunize the priority groups, we'll use whatever vaccine we have available to immunize people who are in the next priority group, and then with subsequent shipments, we'll then open it up to whoever we can immunize.
Flu shots at schools?
We're moving towards that. We'll be opening. The state has been opening discussions with school, and as the local health department in the next few weeks, we'll be opening discussions at school, and we'll be encouraging the schools to look towards administering those flu shots to their students and staff, to look towards getting out information now, getting permission slips from parents who are willing to have their children vaccinated. For the younger ages in elementary schools, we will probably move more towards event days where the parents can hopefully come in and support their children if they want them vaccinated. But yes, absolutely. Schools, hospital, healthcare clinics, all those places.
What would you like to see people do if they come down with the flu? How should they behave?
If somebody has flu-like symptoms, and flu-like symptoms are not generally nausea, vomiting, and diarrhea. We call that the stomach flu, but that's not influenza. Influenza is a respiratory disease. It's characterized by a high fever, generally over 101, 102. We've seen fevers around 103, 104. Body aches. You feel like you've been hit by a truck. Runny nose, cough. You can also have sore throat. You can also have stomach upset. But the main thing is the fever, muscle aches, cough. If you have flu-like symptoms, we would like you to isolate yourself from the rest of the community. So, unlike normal times when we congratulate the worker who comes to work when they feel a little sick and gets the job done, we don't want him to do that if he has flu-like symptoms, because he's going to infect the rest of us. We want them to stay home. We don't want them to go to work. We don't want them to go to school. We also don't want them to go around and hang out in the movie theater or the town square, the courthouse square, if they don't go to school or if they don't go to work. We want them to stay home and try to stop this disease from spreading. We also like everyone to follow universal precautions a little bit more, in a little more detailed fashion than usual. For example, if you have to cough or sneeze, cover your nose and your mouth with a handkerchief or a tissue, and then discard it and wash your hands thoroughly. If you're caught without something like that, the best thing to do is to sneeze into the crook of your elbow, because it's usually big enough to catch your, any sort of droplets that can occur from your nose and mouth. And then try to clean things off and just help. The whole idea is for everyone to be responsible and attempt not to spread any of this virus to other people.
Where can people go for more information about swine flu?
There's a very good website that the CDC maintains, and I apologize, I don't have that URL in my head. If you go to the CDC's website and look for H1N1 influenza, I'm sure you'll find it. The state also has a website where the information is located.
What does H1N1 stand for?
I'm not a virologist, and I'm not prepared to discuss that. That's typing the genetics of the flu virus, and it's looking for it refers to two genetic alleles that are unique in this flu virus. One of them is associated with the swine flu, and one of them is associated with bird flu, avian influenza. The take-home point there is that this is a virus that most people is unusual. It's unique in its genetics. Most people have no immunity to it. There appears to be some sort of cross immunity in elderly people. Interestingly enough, normally we really worry about elderly people getting seasonal influenza because of their weakened immune systems. They tend to suffer most with that, as well as the very young people. But in Indiana and in the United States in general, there have been almost no elderly people hospitalized with H1N1. The people who have had the worst cases, and those still have been relatively mild, have been people that have been under 64 and under. So there's some thinking among some scientists that there's some cross immunogenicity to some virus that these older people may have been exposed to sometime in the distant past. But we don't know what that is.